One of the most common questions I get when it comes to actually giving birth naturally is how to reduce the pain in labor, because there's this narrative out there that birth has to be painful and it's going to be so excruciating. And if you know anything about how I teach childbirth education and how I prepare my clients and my families, you would know that I don't believe that birth has to be painful, but there can be levels of discomfort. So in this video, I want to give you 10 tools that I'm going to be using in my birthing experience and that you can use in yours to reduce your pain and or discomfort to have a much more manageable, positive, and enjoyable natural birth experience. Hey mamas, welcome back to my channel. If this is your first time here, welcome to the Working Mama community where we work together to work our birth. My name is Chanel. I am a doula, childbirth educator, lactation educator, and just lover of all things birth. I am super excited because I am 36 weeks, and if you didn't know, I'm expecting our third child, which is a boy, and we're super excited. But as things have gotten closer and closer to our due date, I have started to do a lot of preparing for our baby because, well, baby could really be here at any point in time. So we are doing all that we can do to make sure that we are prepared for our baby, but I also wanted to share some of the things that I'm doing to help prepare myself for labor. If you're not familiar with the term comfort measure, it is just an opportunity or a tool that you can use to help you feel more comfortable in labor, which of course we all want. The first thing that we're going to talk about is movement. One of the things I'm very big on is making sure that you are active in labor because movement is a comfort measure. When we're moving around, it allows our pelvis to move and open up in different places so that our baby can have more room to descend during our surges. So what does that mean? We should be changing positions based on where a baby is at in the pelvis, and being able to be more active allows our body to be more relaxed. And if we can be more relaxed, we will labor a lot better. So making sure that you stay active in labor is extremely important so that labor can progress and you can focus on the movement rather than focusing on the surge or the contraction that you're going through in that moment. Number two is rest. Just as much as we need to move, we need to rest. And so it's extremely important that we listen to our bodies when we are in active labor, when we need to rest. If we're starting to get tired, because of course a labor is exhausting, if we're starting to get tired, we need to make sure that we're resting. And one of the tools that I like to use for rest is my peanut ball. When I am laboring, and this is the same thing that I did in my second labor experience, using the peanut ball is a very effective way to actually rest because we can use this as an active rest position, meaning that we can still keep our pelvis moving without having to do a ton of work. So what this looks like is you will just be laying on your bed or laying on a hospital bed or wherever it is that you're at, a couch if you're still at home, and you can be laying on your side here. And all you need to do is try to get that top leg up as high as you can over this peanut ball. And so it'll look a little something like this. And when you're laboring, all you have to do is keep your leg up like this and allow the surges to happen, but you are opening up your pelvis in this way, which is allowing you to stay active. You can kind of rock back and forth if you want to, but this is allowing you to stay active, but also allowing you to rest. So it's extremely important that just as much as we move during labor, we're also resting as well. And this will probably be my best friend in early labor because I'm not going to be doing a ton of moving in early labor, but it'll also be really helpful in active labor as things start to pick up and I need to kind of take a break from the movement. Number three is going to be breathing techniques. If you have not practiced breathing throughout your pregnancy, it's going to be extremely important that no matter where you're at in your pregnancy, you start to practice breathing techniques because this is one of the best and easiest ways to relieve any sort of pain or discomfort in labor. This is also really helpful outside of labor if you're experiencing Braxton Hicks, if you have a pain, if you are having cramping or anything along those lines, breathing is going to be super, super important. If you have not checked out my breathing video, make sure that you check that out. I will link it below. I talk about all the different ways that you should be breathing in labor, when you're pushing your baby out, when baby is crowning, and when you're just laboring. So make sure you check that out because breathing is going to be extremely important. And I practice that a lot when I'm working out. I practice that a lot when I am having a bowel movement. I practice that a lot when I am just stressed and overwhelmed. And that plays a very, very big role in labor if you can manage your breath so that you can stay relaxed. Our breath is directly related to how tense or how relaxed our muscles are in the labor process. The fourth technique that I'm going to be using that you should absolutely use as well is hydrotherapy. All that means is water. So shower, bathtub. How can you utilize those in labor? If you did not know, water is nature's epidural. So if you are starting to feel overwhelmed or uncomfortable or feeling like you really want to give up or throw in the towel or get medication, but you desire to have a natural birth, I would highly encourage you to get in the shower or get into the bathtub, because water is very soothing, not just in labor, but in other areas of our life as well. So this can help with cramping, this can help with discomfort, this can help with Braxton Hicks, all of the things. So hydrotherapy is one of my #1 pain relieving tools in labor that you should definitely use and consider when you're laboring. And I know for sure for me, in my second labor experience, being in the water was extremely soothing. It really helped me become more comfortable, and I plan to use it this time around. Comfort measure #5 is going to be aromatherapy. So aromatherapy is just another way of saying essential oils, and essential oils can be extremely beneficial in labor because it can promote relaxation, it can stimulate and release endorphins and oxytocin for you, which is necessary to have an enjoyable birth that progresses. So some of my favorite essential oils for labor are clary sage. Clary sage is really helpful, but should not be used before labor because it can stimulate the production of contractions. The next oil that I like to use is eucalyptus because it is also very calming and soothing. So this could be something that you diffuse while you're actually laboring. Lavender is also very soothing, so you can use this topically or you can use this in a diffuser as well. Rose is also one. I like to make a little bit of a blend of some of these things. So rose is also one that I like to use because it is also very soothing, very comforting, and just makes me feel kind of cozy. And then the last one is peppermint. Peppermint is an absolute must during labor because sometimes we will feel nauseous, sometimes we will feel overwhelmed, and we just want to make sure that if we are starting to feel nauseous or our stomach is starting to hurt or we just feel like we're about to throw up, peppermint is one of the best ways to kind of help soothe that. If you're in your first trimester right now, you can also use this. If you're in your second trimester or even third trimester, you can do this because all you need to do is take a few sniffs of this, and usually it'll help that nausea kind of go away and make you feel a lot more comfortable in the experience. I have used this a lot during my pregnancies because I had really bad morning sickness in my last 2 pregnancies. Thank God I did not have it this time around, but this was also really helpful for me in my second labor experience because I was very nauseous and I did throw up a lot when I was in labor during my second labor experience. And so my doula constantly was allowing me to sniff and just inhale this peppermint. You can of course put it in a diffuser, but you can also just easily take the top off and just allow yourself to breathe it in. Comfort measure #6 is going to be affirmations. So I have a deck of affirmation cards here that one of my friends actually makes. And this is going to be something that I find extremely beneficial and important, not only throughout pregnancy, but in labor, because sometimes our minds can get out of our birth zones or our peaceful places. And we want to make sure that we're staying in those peaceful places so that we can maintain a good mindset to keep us going throughout labor. For some people, reading affirmations, either that you write or that have been created for you already, are really helpful just to remind you to keep going. Another thing that could be helpful is just doing things that make you feel good. Is it something that you want your partner to say? Does hugging and kissing make you feel good? Do you want to watch a movie that's funny? What are the things that make you feel good? Because those are the things that stimulate endorphins and stimulate oxytocin production, which are necessary and essential to blocking pain from reaching your brain. And when we can do that, that'll allow us to have a much more enjoyable and manageable birth experience. I do have a template that you all can use if you want to create your own affirmations, which I highly encourage. I take all of my clients through a process to help them overcome their fears and create their own affirmations so that when they're in labor or throughout pregnancy, because we all know our minds can go to a bunch of different places, the last place we want it to go is somewhere negative when we're laboring. So if we can write and create our own affirmations that actually mean something to us, I think it's extremely beneficial. And this is something that I teach in my program because I think if we can get over some of our fears and actually overcome those with things that make us feel good, we can actually have the labor experience that we want because we know how to stay in the right place mentally. So all that to say, affirmations are going to be extremely helpful for me this time around. I did not use affirmation cards in my second labor experience, but I do plan to use them in this third birthing experience. And this is also something that your partner or your doula or your support person or your children can even read to you and allow them to be involved in that process. Comfort measure number 7 is going to be a comb. If you have not heard of acupressure before, acupressure is extremely, extremely beneficial in labor because it can reduce the sensation of pain. When you are laboring or going through a surge or contraction, all you have to do is actually just grip the comb and squeeze it as hard as you can during a surge. And what that will do is it will block pain from actually reaching your brain through the production of endorphins that actually reach your brain faster than pain can. It is called the gate control theory, and it is amazing, and it's something that we should all learn about when it comes to labor so that you know how to actually allow your brain to work for you and not against you in labor. And this handy dandy tool has been very effective in labor experiences to help block pain because now we're focused on this and not this. So having a comb in your birth bag on hand is going to be extremely important and helpful if you're finding it difficult to actually manage the labor pains and or discomfort of your contractions or surges. Comfort measure number 8 is a rebozo. A rebozo is a long scarf that you can find on Amazon. I'll link one down below. There are a lot of very specific techniques to this, so I won't go into all of them, but I will just say in short that this is not a tool that needs to be used very often, but it can be really helpful when it comes to labor and just allowing your partner or your support person to really kind of take some of the weight off of your belly with this tool. It can be helpful if you need to help get baby into a proper position. It can be helpful if you need to take some weight off. It could be helpful if you're having back pain, and it can be helpful if you're having a difficult time releasing tension in your muscles. So a rebozo is extremely helpful. I have used it in different birthing experiences with my clients. I don't use it that often, like I said before, because a lot of these other tools will kind of take care of those things. But in the meantime, it is something that could be helpful to use on hand. There are a bunch of other YouTube videos out there on how to actually use the rebozo. But if you have a doula or a support person, definitely ask them about this tool and if they're comfortable using it, because it is really, really helpful for me. It's also a helpful tool and something that I will use in labor just to allow myself to squat with a little bit more support. So if you go check out some of those videos, it's definitely something that you can consider using or having on hand. If you don't actually end up buying a rebozo, that's totally fine. You can also use a scarf of your own or a flat sheet. Comfort measure number 9 is a TENS unit. In my second birthing experience, you may have seen pictures on Instagram before, but I did use a TENS unit. And the TENS unit uses electromagnetic waves, connects to your back. If you've ever done shock therapy before, it's very similar to that, but there's a little screen here that you can see. I'll actually turn it on. And you should see different settings here. I don't know if you'll be able to see this because, okay, but if you get one, you figure it out. It's very affordable. I will link the one that I have here below. It is from Amazon. It's pretty affordable, and if you don't like it, you can always return it if it doesn't work for you. But it has different settings, and what those settings will do is it will send these electromagnetic vibrations through these little pads here. And these pads connect to different parts of your back, which in the instruction manual, it will tell you actually where to put them. But when you're having a contraction or a surge, you can increase the vibrations, which allows your body to release endorphins and oxytocin. And again, because of the gate control theory, that will reach your brain faster than pain will. And so this is a little bit of a distraction tool to reduce your body from feeling any pain or discomfort. This was a game changer for me. You can use it in early labor. You can use it in active labor. The only place you can't use it is in the water. I feel like I used this for the majority of my labor experience up until about transition. So I plan to do the same thing this time around. And it doesn't work for everybody, but it did work for me. So I highly encourage everyone to get a TENS unit because I do think it's one of those helpful tools that can't really be replaced with something else. A massage by your partner is great, but it's not going to do the same things as a TENS unit. So I highly encourage attempting it, and I will be using this time around as well. And the last comfort measure that you need is support. Number 10 is support. If you do not have support in labor, and that means mental support, spiritual support, physical support, it is going to be really difficult for you to accomplish all these things on your own. If you are just preparing for your labor by yourself, it can be really isolating in the labor experience because your partner or your support person actually does not know how to effectively support you. Take it from my first experience, my partner and I did not necessarily do the best job of preparing together. We both took classes, but I wasn't very clear or specific on how I wanted him to actually support me in the labor process. So when it actually came time for me to go into labor, he was looking for me to tell him what I needed him to do, and I actually didn't know how to tell him because I didn't know. And in my second labor experience, it was a game changer because both of us were extremely educated and prepared. It is important that your partner is prepared. It is important that you have support, and that can be your partner, or it can be a doula, or it can be a family member. But those people have to be as educated, if not more, than you, so that you can stay in your peaceful place and birth zone, and they can do their job of making sure that you are comfortable. This is one of the things that I am extremely passionate about, because if you and your birth team, that includes your partner, support person, doula, whoever is on your team, know exactly what your wishes and desires are, we can best support you. And so in my Work Your Birth program, I have created it and developed it to be able to prepare all of the people on your birth team so that you and your partner or support person can go into this experience extremely educated and prepared, so that you can have a very confident, manageable, and empowering birth experience. So if you are interested in more coaching, or you're interested in working with me and allowing me to educate and prepare you and your partner, make sure you click on that link below and book a call with me so we can talk about whether or not this is going to be a good fit for you, and if I can help you guys get to where you want to go. So these are the 10 comfort measures that I'm going to be using in my labor experience, most of which I used in my second one, but now just adding to them. If you found this video helpful, make sure you click the thumbs up button so that I can continue to create more content this way. And make sure to follow me on Instagram so that I can share the daily tips and tricks with you from my own birthing experience about labor, birth, and postpartum and pregnancy, as well as my own personal experience to keep you educated and empowered to have the birthing experience that you desire. Thank you again for watching this video, and I will see you on the next one.